Hi friends, welcome back to Dip Clinic. If you're new to the channel, my name's Mike and I'm a cognitive behavioural therapist and first-year trainee doctor in health psychology. Today we're going to discuss some of the reasons why I decided not to pursue a career in clinical psychology. Let's get started. So recently I was speaking to a colleague who's an assistant psychologist at the practice that I'm working, and we were having a bit of a discussion about some of the routes in psychology, and he was letting me know that he was really quite passionate about studying in clinical. As many of you will know, clinical psychology is probably one of the most popular courses in the UK at the moment, and also one of the most competitive. And so really I want to use some of the details from this conversation that I had, and fortunately he's allowed me to do so that I can inform you a little bit about my decision as to why I didn't pursue a route in clinical psychology. So when I was having this discussion with my colleague, the first question that I asked is, well, obviously what route do you want to pursue and what's important to you? And interestingly, from what they told me, they predominantly wanted to work in educational settings and work with a mixture of parents and children to help students to overcome difficulties that they may be experiencing. And so when I asked the question, why specifically do you want to train in clinical psychology? The answer that they gave me was, well, most people do want to train in clinical psychology, and it seems like the best profession if you want to be successful. And so as somebody who wanted to train in clinical psychology, there were a few things that I wanted to address and discuss with this person. So firstly, although clinical psychology is a very rewarding career, it's important to mention that there are several routes that you can take in order to be able to provide therapy for people. And so I think that a lot of people have this connotation with clinical psychology that it's the only route or the only way that you can be able to provide psychological intervention and really find a rewarding career in psychology. But actually, as I found and many other of my colleagues, this isn't necessarily the case. And so let's have a look at a few questions you may want to ask yourself before deciding to pursue clinical psychology. I think the first and most important question is, what type of work is aligned to your values? So if you know that you want to work within the criminal system and work with offenders, then perhaps a career in forensic psychology is more suited to you. If you want to have a look at the ways that our physical health can interact with our mental well-being, then this may be the case that health psychology is a preferred career pathway. And so in the example of my colleague who was really looking to work in educational settings, I'd asked if educational psychology was a career that they'd looked into or explored further. I certainly know that when I started my career, the main thing that I wanted to do was work one-to-one and provide some form of therapy. And predominantly, I wanted to work in a CBT model. And so this is where things got a little bit confusing. At the time, it seemed to be that clinical psychologists were the only people who were doing psychological interventions with clients or patients. And so fortunately at the time I had a colleague who was working in health psychology, so I could ask them some questions. And after a few hours of discussion, actually what I found is that I was actually more oriented to health psychology work. And this profession would also allow me to complete the psychological intervention as I previously wanted. I think the next component that's really important to understand and discuss is, how long do you want to be working and training before you do apply for a doctorate degree or ultimately become a practicing psychologist? It's certainly not unheard of that many people who want to pursue clinical psychology will have to gain 3, 4, 5 and sometimes 6 years of experience before being accepted onto a doctorate course. And so this can make your overall training within clinical psychology anywhere between 6 to 10 years depending on the speed of that process. Now, I think it's really important to mention here that I work with many clinical psychologists, and I genuinely think that if that is the career path that you really do want to go down, then you should certainly pursue it. But I do know that within my example, I didn't want to be working within several assistant psychology posts. And so now when I look at the course of my career, when I finished my master's degree, it was only about 12 to 18 months until I was actually working with clients and providing psychological treatment to them. And this is why I think it's really important to be aware of your own competencies and your own timelines when you're deciding on a career in psychology. And finally, one of the main components when I was deciding on a career in psychology that I took into account was that I really wanted to become a doctor. There's many different routes that you can take into work within a mental health or psychology field that don't require the title of a doctor. And so if we look at cognitive behavioural therapists, for example, you will only usually need a master's degree or a postgraduate diploma before you can start this work. And so it's not always necessary that you have to do this several years of training in order to reach that goal if that's what you want to do. I think one of the main considerations considerations that trainees should take into account, however, is that there is many routes to working in psychology. Fortunately, with the hindsight that I now have of going through the process, I think it's increasingly important that we have a range of different specialties and practitioners from different areas. And this is ultimately how we're going to progress within the field and be able to continue to provide a range of different support for individuals, groups, and organisations. Ultimately, I came to find that I loved working in a health field. And based on that value, I was quite easily able to say, okay, well, maybe health psychology really is the career for me. But this is something that 3 years ago I'd have probably had no consideration of. And so those are some of my reflections on why I decided not to pursue clinical psychology. And I hope that this provides you with some insight about the different professions that you could look into. If you're still unsure, I definitely recommend having a chat with some of these practitioners. So this could mean speaking to a clinical or a health psychologist on LinkedIn, for example, and getting a little bit of insight into what they actually do within their careers and their day-to-day jobs. I found this really helpful in understanding what the different possibilities are within psychology. And so if you have any questions about working in health psychology or within CBT, feel free to leave them in the comments below. Once again, I hope you found this video useful, and please stay posted for more psychology and therapy content coming soon. I hope that you all stay safe, and we'll look forward to seeing you in the next one. Take care.